In our previous video, we discussed about the glomerular filtration rate or GFR. Now let's discuss the main determinants of this filtration process and to also describe how these individual parameters they can determine the GFR. The two main determinants of GFR are the filtration coefficient or KF, which is expressed in milliliter per minute per millimeter of mercury, and the net filtration pressure. This is expressed in millimeter of mercury. So the GFR is simply the product of this net filtration pressure and the filtration coefficient. The filtration coefficient, it is proportional to the surface area of the glomerular filtering capillaries and also its fluid conductivity, or simply you can say the permeability of the filtering capillary, the glomerular capillaries. Now it's worth noting that the glomerulus is extremely conductive capillary bed. So the filtration coefficient for a typical glomerular capillary is approximately 400 times larger than a normal systemic capillary bed. So that is the reason that the glomerular capillaries, they are highly specialized for the formation of ultrafiltrate. And this high filtration coefficient, it contributes to the rapid rate of fluid filtration in the glomerular capillaries. Although there are certain instances where this filtration coefficient, it can change either during normal or pathological conditions. The main regulatable parameter that can influence the GFR, it is the net filtration pressure or PNET. This net filtration pressure, it is determined by the balance of the Starling forces. And these Starling forces, these are the forces or pressures that drive the exchange of fluid through the walls of the capillaries. Now, the two main components that determine this net filtration pressure are the hydrostatic pressures, which is the pressure that is exerted by fluid in a confined space, and the oncotic pressure, which is the osmotic pressure exerted by dissolved proteins and associated counterions. Now, as we are talking about the movement of fluid from two separate chambers, which means that the between the lumen of the glomerular capillaries and the Bowman space. So these two pressures, the hydrostatic and oncotic pressures, they can be divided into four components. The hydrostatic pressure within the glomerular capillaries, which is essentially the blood pressure in the glomerular capillaries. The second is the hydrostatic pressure within the Bowman space. There is also the plasma oncotic pressure within the glomerular capillaries, and this is largely due to the presence of dissolved proteins, dissolved plasma proteins such as albumin. And the last one is the oncotic pressure within the Bowman space. But it is usually negligible due to the very low concentration of dissolved proteins within the glomerular filtrate. But it is worth noting that this parameter, it can be increased in certain pathological conditions such as glomerular nephritis. Now, in order to see how these individual pressure components, they can determine the net filtration pressure and ultimately the GFR, we need to organize them between those pressure components which tend to favor the filtration and those which tend to oppose the filtration. Now, the pressure components which favor the filtration, these are those which tend to promote the movement of water and other dissolved solutes from the glomerular capillaries into the Bowman space, or which are favoring the filtration. These pressure components are the hydrostatic pressure within the glomerulus and the oncotic pressure within the Bowman space. And again, because this oncotic pressure in Bowman space, it is usually negligible because the ultrafiltrate has very negligible amount of dissolved proteins. So it is the glomerular hydrostatic pressure which is the main parameter and tends to be the main driving force for the movement of the fluid from capillary bed into the Bowman space. Conversely, the pressure components which tend to oppose the filtration, these are the oncotic pressure within the glomerulus, and this oncotic pressure actually tends to pull the fluid from Bowman space into the glomerular capillaries. And then also the hydrostatic pressure in the Bowman space, and it exerts a hydrostatic pressure that tends to push the fluid from the Bowman space into the glomerular capillaries, which means that they are actually opposing the filtration. So the net filtration pressure, it can be determined by the magnitudes of each of these individual pressure components. Now let's consider some reasonable pressure values. The glomerular hydrostatic pressure, it is approximately 60 mm of mercury. The hydrostatic pressure in the Bowman space, approximately 18 mm of mercury. The oncotic pressure in the glomerulus is approximately 32 mm of mercury. And the oncotic pressure in the Bowman space, that is negligible. So the net filtration pressure will be 10 mm of mercury. Also, it's important to note that some of these pressure values, they may change in different physiological conditions, whereas others are altered in pathological conditions. So this net filtration pressure, it determines the driving force for the fluid movement from the glomerular capillary into the Bowman space. Now, as the GFR is a product of the net filtration pressure and the filtration coefficient, and also the reasonable filtration coefficient for 2 kidneys in a normal 70 kg individual is around 12.6 ml per minute per millimeter of mercury. So the GFR of 125 ml per minute will be produced. Now this is the 125 ml of blood plasma that is moving from the glomerular capillaries into the Bowman space every minute. And this amounts to the filtration of around 1 liter of blood plasma every 8 minutes and 180 liters per day. And this is a tremendous amount of fluid that's being filtered by the kidneys. So there are the 4 main pressure components which determine the net filtration pressure and ultimately the GFR. But the 2 appear to be the most readily regulatable by the kidneys, and these are the hydrostatic pressure in the glomerulus, which tends to favor the filtration, and the oncotic pressure in the glomerulus, which tends to oppose the filtration. So it's clear that the factors which will increase the glomerular hydrostatic pressure will increase the net filtration pressure, and therefore the GFR will be increased. And conversely, the factors which tend to decrease the glomerular hydrostatic pressure will tend to decrease the net filtration pressure, thereby reducing the GFR. And these changes in the net filtration pressure, they can also be accomplished by modulating the oncotic pressure within the glomerulus. So either an increase or decrease in this oncotic pressure in the glomerulus will result in the respective changes in the GFR. In the next video, we'll talk about how the changes in these factors will eventually change the glomerular filtration rate.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.